Hello and welcome to Zoom In on Autoimmunity, introducing the Lyme Autoimmunity Panel and the Autoimmunity Zoomer. My name is Adair. I'm a registered dietitian nutritionist and the product marketing educator here at Vibrant. Before we get started, I want to go over some housekeeping items. All attendees are in listen-only mode. If you have any questions during the presentation, please submit them as a comment. There will be time at the end for Q&A. This webinar is being recorded, and you'll get a copy of the recording and the slides after the webinar ends. The learning objectives for this presentation are to understand the scope of autoimmunity testing, explore the root causes of autoimmunity, visualize the role of molecular mimicry in autoimmunity, learn about the new Lyme Autoimmunity and Autoimmunity Zoomer, and apply new testing insights in clinical practice. Let's start with the scope of autoimmunity testing. There are two types of autoimmune diseases: systemic autoimmune diseases that affect multiple organs or systems like lupus, Sjogren's, and scleroderma, and organ-specific autoimmune diseases that target specific organs like type 1 diabetes, Hashimoto's thyroiditis, and celiac disease. There are several types of tests used for autoimmune diseases. Functional tests, which assess immune system functions such as lymphocytic proliferation tests and cytokine profiles. Imaging tests used to evaluate structural changes in organs such as X-rays, MRIs, and CT scans. Genetic tests, which identify genetic predispositions to autoimmune diseases like HLA-B27 and HLA-DR4. And serological tests, which detect specific autoantibodies in the blood. This includes markers like anti-nuclear antibodies, rheumatoid factor, anti-cyclic citrullinated peptide, and anti-Smith antibody tests. This webinar will focus on serological testing, as that is what Vibrant does best. There are two main types of biomarkers for autoimmune disease. These are autoantibodies, or proteins produced by the immune system that mistakenly target the body's own tissues, as well as inflammatory markers that indicate inflammation in the body, like C-reactive protein, for example. These tests and biomarkers are regularly used for diagnosis, meaning confirming the presence of an autoimmune disease, also monitoring, tracking the disease progression and treatment effectiveness, and prognosis, predicting disease outcomes based on biomarker levels and genetic predispositions, as well as to personalized medicine or tailor treatment plans specifically based on those test results. Conventional medicine has a black and white interpretation of autoimmune disease. Either you have the disease or you don't. In functional medicine, however, we see health as a spectrum. Like other complex diseases, we know that autoimmune diseases develop over several years. And the goal is really to detect the signs and symptoms of autoimmunity early so that we can implement timely and targeted treatment, preventing disease progression and improving patient outcomes. According to Dr. John Bartimus, diagnosis often occurs only after we see the signs and symptoms. However, we know that antibodies appear before the patient starts to experience those symptoms. Therefore, if you know an autoimmune condition is developing in your patient, you can slow or prevent disease progress by identifying antibody levels early on. So, what is the root cause of autoimmunity? Let's start with the definition. Autoimmunity is a condition in which the immune system mistakenly attacks the body's own cells, tissues, and organs, leading to immune responses against its own tissues. Now, normally the immune system defends against harmful invaders like bacteria and viruses. However, in autoimmune diseases, the immune system fails to distinguish between foreign substances and the body's own healthy cells, leading to inflammation and tissue damage and dysfunction of the affected organs. Autoimmunity is basically a loss of cell tolerance. And while the exact pathogenesis is still unknown, studies report that multiple factors result in the loss of immune tolerance observed in autoimmune diseases. Let's review the mechanisms leading to autoimmunity now. There are four main ways in which autoimmunity happens, especially in the context of infectious diseases. These are molecular mimicry, bystander activation, epitope spreading, and cryptic antigens. Molecular mimicry is when a sequence of amino acids present in the infection is similar to a sequence of amino acids in your own tissue, resulting in your immune system getting confused and attacking cell tissue. Note that even when the external infectious agent is gone, your immune system is still seeing that sequence of amino acids and continues producing antibodies against it, resulting in chronic inflammation. Number two, bystander activation. This is when the local inflammatory milieu promotes non-specific T cell activation. In other words, some of the T cells present where the localized immune response is happening may be against self antigen. Now, ideally, T cells against self antigen are quenched by your T regulatory cells, but because they're in that inflammatory environment, they could also get activated, leading to immune intolerance. Number three, epitope spreading. This is the simultaneous presentation of foreign and self peptides under T cell activating conditions that result in activation of self reactive T cells. Said another way, this is when self reactive T cells get activated towards neighboring epitopes of the region that were originally targeted. And unfortunately, those epitopes correspond to your self antigens. And number four, cryptic antigens. This is when tissue damage exposes a broad array of self antigens, including some that are self reactive due to incomplete negative selection. In an inflammatory state, antigen presenting cells can digest the proteins in the milieu and present them for antibody production. Therefore, when there's a lot of localized damage, self tissue could also get presented, and thereby you could start developing antibodies towards your cell tissue. It is well known that infectious agents can cause autoimmunity. Here are some common pathogens and mechanisms by which they trigger autoimmune diseases like lupus, antiphospholipid syndrome, rheumatoid arthritis, multiple sclerosis, Sjogren's, and type 1 diabetes. Lyme disease can also cause autoimmunity. Briefly, Lyme disease is a vector-borne illness primarily transmitted to humans through the bite of infected ticks. The disease is caused by the bacterium Borrelia burgdorferi and, less commonly, Borrelia mayonnaise. Initial symptoms of Lyme disease often include fever, headache, fatigue, and the characteristic skin rash erythema migrans, also known as the bullseye rash. If left untreated, the infection can spread to joints, heart, and nervous system, leading to more severe and chronic health problems. Specifically, through molecular mimicry, Lyme disease can trigger these three autoimmune conditions. 60% of patients with Lyme disease end up with Lyme arthritis, 4 to 10% develop Lyme carditis, and there is a 10 to 15% prevalence of Lyme neuroborreliosis. Now, let's take a look at the Lyme arthritis marker tetraspanin 7, or TSPAN7 for short. TSPAN7 is a newly identified glycoprotein that shares sequence similarity to the Borrelia protein OSPA. Antibodies against OSPA may remain in Lyme disease patients long after antibiotic treatment. This may result in cross-reactivity between these antibodies and TSPAN7, resulting in Lyme arthritis. Cross-reactivity of anti-OSPA antibodies with TSPAN7 had been observed previously in Lyme arthritis patients. ApoB100 is an apolipoprotein that has a role in the transport of cholesterol in the body. Borrelia burgdorferi cannot make its own lipids, so acquires lipid molecules from the host, resulting in the bacteria having a similar lipid composition as the host. Autoantibodies may be released against the host lipoproteins like ApoB100 that bind to the bacterial lipids, resulting in an immune response. ApoB100 can be considered as an autoantigen of Lyme carditis, as autoantibodies against this lipoprotein are observed in patients with Lyme carditis. Peptidoglycan is a polysaccharide that forms the cell wall of bacteria. Peptidoglycan from Borrelia burgdorferi is recognized by toll-like receptors, not proteins, and peptidoglycan recognition proteins, resulting in pro-inflammatory immune response in the synovial fluids. That thick, viscous fluid that lubricates and cushions the ends of our bones in the synovial joints. Borrelia burgdorferi sheds peptidoglycan as they replicate, resulting in high levels of PG in the synovial fluid. Peptidoglycan could remain in the synovial fluid for months and years after antibiotic treatment, resulting in chronic inflammation of the synovial fluid, contributing to Lyme arthritis. Many patients with chronic symptoms like joint pain, fatigue, and neurological issues struggle with diagnosis and often undergo multiple antibiotic rounds without relief. Wouldn't it be awesome if there was one panel that could help confirm post infectious Lyme autoimmunity? When patients understand it's autoimmunity perpetuating symptoms and no longer the active infection, they are much more motivated to adopt anti inflammatory diets and lifestyle changes. Having a test like this could shift treatment away from overusing antimicrobials and towards strategies that calm the immune system, protect the heart, joints, and brain, and promote healing. Additionally, instead of general anti inflammatory treatment, it could inform targeted protocols addressing specific markers, thus reducing the need for multiple treatments, multiple supplements, or medications, and limiting out of pocket costs to patients. Great news! That test now exists. Vibrant Wellness saw the need and created the Lyme Autoimmunity Panel. The Lyme Autoimmunity test has three subpanels: Lyme arthritis, Lyme carditis, and Lyme neuroborreliosis, including 8 Lyme arthritis markers, 1 Lyme carditis marker, and 2 Lyme neuroborreliosis markers. Molecular mimicry is the mechanism for 5 of these markers: tetraspanin 7 or T-span 7, endothelial cell growth factor or ECGF, matrix metalloproteinase 10 or MMP10, annexin A2, and ApoB100. Epitope spreading is the mechanism for another 5 markers: collagen B alpha 1, laminin beta 2, fibronectin, GM1, and the dopamine receptor. And we've already talked about the mechanism behind peptidoglycan. The report comments provide details for each marker that is above the reference range. Here, the comment for ECGF states, ECGF is a newly identified autoantigen in Lyme arthritis. ECGF shares similar sequence with a peptide derived from the BB0580 of Borrelia. Autoantibodies against ECGF were observed in Lyme arthritis patients and were also shown to be associated with increased interleukin 23 levels. It has been suggested that excessive accumulation of ECGF in the joints of Lyme patients results in immune responses against it. These antibodies were observed before the onset of the disease. Now, I highlighted share similar sequence to the Borrelia protein OSPA and share similar sequence to the peptide derived from Borrelia and possible MMP10 activation by protein bound to the Lyme bacterium to emphasize that all the markers on the Lyme autoimmunity test are specific to the Lyme disease bacterium Borrelia burgdorferi. In fact, these 5 Lyme arthritis report comments also mention Borrelia. Here's a similar comment for the Lyme carditis marker ApoB100. And the 2 Lyme neuroborreliosis markers, GM1 and dopamine receptor, are also specific to Lyme disease caused by Borrelia burgdorferi. Which is why we'll be including a copy of the Lyme Autoimmunity all out of range sample report in addition to the recording and slides we send you after this webinar so you can learn more about each Lyme autoimmunity marker. In fact, let's do a sample report walkthrough now. The cover page identifies the sample type and includes the results interpretation key. Vibrant's Lyme Autoimmunity Panel is a blood test collected via venipuncture. Fasting is not required, and there are no dietary or medication restrictions. However, as with all antibody testing, patients taking steroids, immunosuppressive medications, biologic agents, or other immunomodulating medications may have falsely lower or falsely increased total or specific immunoglobulin results. And more on this when we get to the complementary tests. The introduction page is where you can find the methodology and interpretation of report, and I highly recommend reading this page, especially the part where it says, the Vibrant Lyme Autoimmunity Immunochip test is a semi-quantitative assay that detects IgG antibodies in human serum for the Lyme autoimmunity antibodies with multiplex chemiluminescence immunoassay methodology. And also the part where it says, reference ranges have been established using a cohort of 192 apparently healthy individuals, as well as the explanation of the color classification. Specifically, the classification of green denotes a result that is within the normal reference range. The classification of yellow denotes a result that is moderately elevated with respect to the reference range. And the classification of red denotes a result that is elevated with respect to the normal reference range. Vibrid's proprietary microarray works similar to ELISA methodology. However, instead of one antigen per well, we can measure up to 96 antigens per well. This is possible because we attach each antigen to silicone wafers and dice those wafers into tiny microchips. Then arrange the microchips, one for each antigen, in a 4x4 or 10x10 grid atop one pillar on a 96 or 24 pillar plate. 10 by 10 equals 100 minus 4 controls equals 96 antigens tested. The pillar plate is then submerged into the patient blood sample, allowing for the simultaneous analysis of a large number of analytes from a single sample. Finally, high-resolution imager is used to simultaneously detect chemiluminescent signals from labeled antigen-antibody reactions at each microchip throughout the multiplex microarray. Amplified chemiluminescent signals with a high signal-to-noise ratio provide high sensitivity, meaning very few false negatives. This automated process allows for high throughput, sensitive, and specific analysis of multiple biomarkers for minimal sample volumes. As I said before, the reference ranges were determined from samples of 192 apparently healthy individuals. Those levels were plotted on a Gaussian curve. And as you know, Gaussian distributions are important in statistics and are often used to represent real value random variables whose distributions are not known. As you can see in the Gaussian image, 68% of values fall within one standard deviation from the mean, 95% fall within two standard deviations from the mean, and 99.7 fall three standard deviations from the mean. For the Lyme autoimmunity test, when your patient's value is high, it's higher than 97.5% of healthy individuals. The results are reported as both a number and plotted graphically so you can visually see how high or low your patient's results are. In this example, the patient has normal antibody levels to T-span7, ECGF, MMP10, Nexin A2, and peptidoglycan. Note, the reference range indicates normal antibody levels are less than or equal to 10. However, this patient has moderately elevated antibody levels of collagen V alpha 1 and laminin beta 2, and elevated levels to fibronectin. Fibrin includes interpretive comments for all antigens that are outside the reference range, so if you want to learn more about a patient's moderate or high levels, you can always scroll back to the summary and read those comments. So, which patients benefit most from this test? Well, patients with chronic fatigue, joint pain, or unexplained neurological issues, patients with heart irregularities or other Lyme-like symptoms, patients with a family history of autoimmune diseases, and patients who've had a tick bite or live in Lyme endemic areas. Before we talk about complementary tests, I want you to think about Dr. Cindy Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to the Lyme Autoimmunity Panel, consider the tick-borne diseases test to comprehensively assess both the presence of tick-borne infection and any autoimmune responses triggered by those infections, facilitating a more accurate diagnosis and tailored treatment approach. Also, the gut zoomer for aid in diagnosing and treating microbiome dysregulation following antibiotic usage. Or the wheat zoomer, which offers an intestinal permeability panel which can aid in diagnosing leaky gut syndrome that may result from extended antibiotic usage. The mycotoxins test to answer the question, is it Lyme, mycotoxins, or both? Numerous symptoms overlap between Lyme and mycotoxin-related illnesses, and resolving tick-borne diseases may be more challenging when mold and mycotoxin illnesses are present. Also, the NeuroZoomer Plus, which measures specific neurological antibodies that have been associated with Lyme diseases, such as antitubulin, anti-NMDA, and anti-neuron-specific enolase. And finally, the total immunoglobulins test. Serology testing is based on normal functional immunoglobulin production. The total immunoglobulins test assesses the number of immunoglobulins, which is helpful in those with suspected immune function compromise or those undergoing IV IgG therapy. In summary, the Lyme Autoimmunity Panel uses highly specific and sensitive microarray methodology to measure 11 antigens known to trigger autoimmune conditions, providing diagnostic clarity for chronic Lyme symptoms. Of course, the most comprehensive workup would also include rheumatoid factor and CCP3 antibodies to confirm if it's Lyme arthritis or rheumatoid arthritis, which is a great segue into Vibrant's other new test, the Autoimmunity Zoomer. The Autoimmunity Zoomer is a comprehensive panel designed to detect and monitor multiple autoimmune conditions by measuring 63 specific autoantibodies and antigens, indicating a variety of systemic and organ-specific autoimmune conditions for an integrated approach to managing autoimmune disorders. Now, if you've ever ordered an extractable nuclear antigen or ENA panel, some of these markers should look familiar. Let's do a quick walkthrough of the Autoimmunity Zoomer report. The Autoimmunity Zoomer requires the same sample type and has the same results interpretation key as the Lyme Autoimmunity test. Again, I highly recommend reading the methodology and interpretation of report, especially the part where it says, the Autoimmunity Zoomer provides concise information by representing the list of antigens with positive serology antibody titers that are outside the normal reference range. And also the part where it says, reference ranges have been established using a cohort of 192 apparently healthy individuals, as well as the explanation of the color classification. Specifically, the classification of green denotes a result that is within the normal reference range. The classification of yellow denotes a result that is moderately elevated with respect to the reference range. And the classification of red denotes a result that is elevated with respect to the normal reference range. We use a proprietary microarray plus chemiluminescence to measure antibody levels on the Autoimmunity Zoomer test. And the full report lists the levels of all 63 markers, including the blood vessel markers beta-2 glycoprotein 1, cardiolipin, and proteinase 3, the central nervous system marker myelin basic protein. The markers listed under dry eyes and mouth are the Sjogren syndrome-related antigens, SSA 52 kilodalton, SSA 60 kilodaltons, SSB, and alpha-fadrin. The Autoimmunity Zoomer also includes the eye antigens aquaporin 4 and interphotoreceptor retinoid binding protein. Gut antigens include markers used to diagnose celiac disease, tissue transglutaminase, TTG, and deaminated gliadin peptide, DGP, as well as parietal cell antibodies and antibodies to the yeast Saccharomyces cerevisiae. The immune health markers include platelet antigens and interferon alpha beta receptors. Autoimmunity Zoomer also includes HSCRP in the inflammation category. The joints and arthritis section includes the standard markers for diagnosing rheumatoid arthritis, which is rheumatoid factor and anti-CCP3, along with collagen type 2. Alpha-actin is associated with autoimmune membranous nephropathy. Smooth muscle antibodies are an indicator of autoimmune hepatitis type 1. Meanwhile, microsomal antibodies are found in autoimmune hepatitis type 2 and other autoimmune liver diseases. All the markers in the mixed connective tissue section are diagnostic for mixed connective tissue disease. And the muscular system section includes markers found in autoimmune myocarditis, titin, and cardiac myosin, as well as markers associated with autoimmune inflammatory myopathies and scleroderma. The 5 antibodies against the pancreas include anti-insulin, islet cell antigen 1 and 2, which are early indicators of type 1 diabetes, and 2 GAD antibodies associated with type 1 diabetes and also neurological disorders. The peripheral nervous system markers GM1 and myelin-associated glycoprotein are associated with autoimmune neuropathies, but GM1 is associated with Guillain-Barré syndrome specifically. Skin markers include antigens associated with scleroderma, skin itching, and autoimmune blistering and skin disorders. Thyroid markers include thyroglobulin and thyroid peroxidase. The systemic autoimmunity section includes antigens used to diagnose systemic lupus erythematosus and mixed connective tissue disease. And the Autoimmunity Zoomer also includes anti-nuclear antibodies, ANA. As you can see, the Autoimmunity Zoomer includes tons of markers providing insight on multiple systemic and organ-specific autoimmune conditions. Just like the Lyme Autoimmunity test, results are reported as both a number and plotted graphically so you can visually see how high or low your patient's results are. The reference range for most autoimmunity Zoomer analytes indicates normal antibody levels are less than or equal to 1.0. However, some antigens have a lower reference range, as is the case for tissue transglutaminase and deaminated gliadin peptide. Meanwhile, other antigens have a higher reference range, as is the case for the thyroid antigens thyroglobulin and thyroid peroxidase, and the systemic autoimmunity antigen double-stranded DNA. Also note that ANA is reported as either negative or positive, and if positive, the pattern will appear here, either speckled, nucleolar, rim, cytoplasmic, centromere, or homogeneous. At this point, some of you may be thinking, why would I order this test instead of a single panel or two from the Vibrant America test menu? Great question. I'd love to answer it. For those who don't yet know, the Vibrant ordering portal has a Vibrant America tab and a Vibrant Wellness tab. Tests located in the Vibrant America tab include standard panels like the Basic Metabolic Panel, Comprehensive Metabolic Panel, glucose, hemoglobin A1C, cholesterol. You get the idea. These tests report values without comment or interpretation. In contrast, Vibrant Wellness tests are lab-developed tests that do include additional helpful information. And both the Lyme Autoimmunity and Autoimmunity Zoomer are housed in the Vibrant Wellness tab. On the left is a Vibrant America report of the rheumatoid arthritis markers, HSCRP, and rheumatoid factor. And note that only the patient's values are reported. On the right is the Autoimmunity Zoomer, which also reports HSCRP and RF, but includes comments such as clinical significance, associated damage, and suggested supplements. Zooming in, RF is a diagnostic for rheumatoid arthritis. It's associated with chronic inflammation of the synovial joints, leading to joint damage, deformity, and disability. The Autoimmunity Zoomer report includes unique supplements shown to either help reduce specific antibody levels or supporting supplements generally considered helpful for autoimmune conditions. For example, the comments for rheumatoid factor includes omega-3s, dietary fiber, echinacea, and glucosamine, chondroitin, and MSM. Again, we'll be emailing you the 29-page all-out-of-range report so you can view the comments for every single marker on the Autoimmunity Zoomer report. So, which patients benefit most from this test? Well, patients experiencing unexplained symptoms like chronic fatigue, joint pain, skin rashes, digestive issues, or neurological problems. Also, those with a family history of autoimmune diseases, and those presenting with conditions that have not responded to standard treatments. In addition to the Autoimmunity Zoomer, consider the Wheat Zoomer to identify the patient's full range of wheat and gluten sensitivities, as well as the intestinal permeability that may be contributing to autoimmune symptoms. Also consider the Gut Zoomer to assess for dysbiosis, which may play a role in the development of rheumatoid arthritis and other autoimmune diseases. A full thyroid panel, which evaluates for thyroid diseases which are more prevalent in patients with other autoimmune conditions. Also consider ordering tick-borne disease to investigate infectious disease from tick-associated organisms that can later trigger autoimmune conditions. Or cut straight to the chase and order Lyme Autoimmunity, which identifies antigens known to trigger the autoimmune conditions Lyme arthritis, Lyme carditis, and Lyme neuroborreliosis. When paired with the Autoimmunity Zoomer, the Lyme Autoimmunity test can help determine if the patient has Lyme arthritis versus rheumatoid arthritis, making this pairing valuable for differential diagnosis. And finally, total immunoglobulins for the same reasons discussed earlier. In summary, the Autoimmunity Zoomer uses highly specific and sensitive microarray methodology to measure 63 specific autoantibodies and antigens indicating systemic autoimmunity, thyroid conditions, rheumatoid arthritis, type 1 diabetes, and more for an integrative approach to managing autoimmune diseases. Before we end, let's summarize everything we've covered with some clinical pearls. Here are 4 clinical pearls for the Lyme Autoimmunity test. Number 1, diagnostic clarity for chronic Lyme symptoms. Many patients with chronic symptoms like joint pain, fatigue, and neurological issues struggle with diagnosis, often undergoing multiple antibiotic rounds without relief. The Lyme autoimmunity confirms post infectious Lyme autoimmunity from Borrelia proteins via mechanisms like molecular mimicry or epitope spreading. Number two, improved patient compliance. Patients with chronic Lyme symptoms often experience frustration from ineffective treatments. This test helps clarify the connection between Lyme disease and their autoimmune response. And when patients understand the root cause of their symptoms, they're more likely to adopt anti inflammatory diets and lifestyle changes. This enhanced compliance not only improves health outcomes for the patient, but also boosts patient satisfaction and trust in their healthcare provider, fostering a collaborative and proactive approach to managing health. Number three, cost effective and comprehensive management. This panel identifies specific forms of autoimmunity, providing clarity on each patient's inflammatory process. So instead of general anti inflammatory treatments, it informs targeted immune modulation and inflammation reduction protocols for specific markers, thus reducing the need for multiple supplements or medications and limiting patient out of pocket costs. And finally, number four, early detection for at risk populations. Early detection of Lyme linked autoimmune response is pivotal for those diagnosed with Lyme disease. This early intervention can prevent the progression of post infectious Lyme autoimmunity into severe manifestations. By screening at risk populations, healthcare providers can start treatment sooner, minimize the risk of long term complications, and promote a quicker return to health. Early detection empowers patients and providers to act proactively, enhancing patient outcomes and quality of life. Here are four clinical pearls for the autoimmunity zoomer. Number one, precision in autoimmune detection. The autoimmunity zoomer utilizes solid phase biochip immunofluorescent assay and ELISA technology to provide precise detection of autoimmune markers. This dual ANA and ENA testing achieves higher sensitivity and specificity than standard testing, ensuring accurate evaluation of autoimmune diseases. Number two, early detection for complex autoimmune disorders. The autoimmunity zoomer is particularly helpful for patients presenting with non-specific symptoms such as chronic fatigue, joint pain, and gastrointestinal issues. Early detection of markers like anti-CCP for rheumatoid arthritis and TTG for celiac disease can lead to timely and targeted treatment, improving patient outcomes and preventing disease progression in vulnerable populations. Number three, comprehensive autoimmune health insight. By covering a broad range of autoimmune markers, including those for multiple sclerosis, Sjogren's syndrome, and lupus, Autoimmunity Zoomer serves as a comprehensive tool for investigating the root cause of chronic illnesses. This holistic approach allows healthcare providers to uncover underlying autoimmune responses that may contribute to systemic conditions, facilitating more effective and tailored interventions. And four, integrative management of autoimmune diseases. Combining the autoimmunity zoomer with other diagnostic tools, such as the gut zoomer and wheat zoomer, supports a comprehensive approach to managing autoimmune diseases. This integrated strategy enables personalized treatment plans that address the complex interplay of genetic, environmental, and lifestyle factors, promoting overall health and long term disease management. Finally, here are resources you can use to educate your patients about these new tests, including patient one pagers, markers lists, key clinical messages, and sample reports. Here are the references for the Lyme Autoimmunity Panel and references for the Autoimmunity Zoomer. And that's it. Thanks for your attention. Please let me know if you have any questions.